Scoliosis is an abnormal curvature of the spine. While many people think of it as a childhood affliction, it does impact adults as well. Here to talk to us a little bit more about this, Dr. Shea Bess from the Denver International Spine Center over at Presbyterian St. Luke's Medical Center. Dr. Bess, many of us, of course, remember getting checked for this condition as kids. And if we didn't have it then, I guess we're here to talk about the fact that we do get it later in life. It's possible.
Jim, that's a great question. So, there's several etiologies or causes for scoliosis, especially in adults. One could be carryover from adolescence into adulthood, but what can also cause scoliosis is arthritis, or what's called degenerative scoliosis, which typically happens in the low back or the lumbar spine. And so while there are fewer patients that have childhood scoliosis that carries over into adulthood, about 50 to 60% of patients that then go on to have arthritis will have scoliosis in their lumbar spine. So it can carry over with high percentage.
Tell me a little bit more about some of the things that we should be looking out for, doctor, as we go on with our lives.
That's a really good question. And one of the things is asymmetry across your back. And the other piece also is you can start developing back pain, feeling pitched forward or feeling pitched to the side. It can also cause leg pain, or where the nerves themselves get pinched either by the curvature of the spine or by narrowing of the canal or the canal where the nerve roots go.
What some of the treatments? Is it something that if it's detected early, like so many other things in medicine, that's advantageous to the treatment plan?
Really good question. The vast majority of people that have scoliosis can be treated effectively, non-operatively with physical therapy. And if need be, you can get injections either to help relieve the nerve pain or the back pain. So even caught early, physical therapy can help tremendously. The back brace, while it's helpful in childhood, because the main goal in childhood is to stop the progression of the curve. In adulthood, it's not as effective, but you're very low risk in adulthood for rapid progression of the curve. Mm-hmm. And so really using it to treat it just for the symptoms alone.
Tell us anything, doctor, that we might be able to do to prevent this.
That's a great question. I think most of it really is staying active, right? And being aware that if you develop scoliosis, it's not dangerous. It'd be very uncommon that it would be. The main thing, though, is staying active. And if you start getting symptoms, physical therapy can help you. In addition to, if need be, some injections. Very rarely would go on to have surgery.
Doctor, we've tried to come up with some questions that we know our audience would be interested in, but you know so much about the subject matter. Don't let us forget anything. What would you like to tell our viewers that they should know about this?
That's excellent. And one of the main things is that the old teaching was that scoliosis is not painful. However, a large amount of the research that we have done through our private foundation has shown that scoliosis is in fact painful. And the reason why it is because it pitches patients over to the side and then pitches patients forward. So they have a difficulty standing upright. And so they're always fighting gravity. And so while, again, that old adage was that it was not painful, we know that it is. And then treatments to help the individual stand upright can be very effective in relieving pain.
All right, Dr. Shea Bess, thank you so much, sir, for sharing all this important information. And we look forward to chatting again sometime soon.
Thanks, Jim. Congratulations.
Thank you, sir.